What do you say though, Governor, to conservatives who are now saying essentially what you're saying? This is a failed system. We want to just repeal it and replace it, and it's a diversion to talk about fixing it.
Well, I think the closest thing we've seen, and a bill that I couldn't fully support, but there were aspects that I really liked, was Graham Cassidy. And that provided tons of flexibility, a giant block grant back to the states that provided the states to design their own system and essentially start reinstilling a free market back into healthcare, which we don't have right now. Our healthcare costs are really based on politics more.
One other thing, Governor, you mentioned that you favored Graham Cassidy, the proposal that didn't ultimately get anywhere in the Senate, that gives states a lot more power, which must sound appealing if you're a governor. But it appeared that that legislation, had it passed in the form that it was written, would have caused tens of millions of people to lose health insurance. Why was that a good idea?
Well, so let's back up. I did not favor Graham Cassidy in the whole because New Hampshire would have lost close to $1 billion of funding. It simply wasn't fair. Some states were getting billions of more. I liked the flexibility. What I want to see is the flexibility of Graham Cassidy without penalizing states. The billions of dollars that places like New Hampshire and even Massachusetts were going to face. So there's a middle ground there. But the flexibility is far and away the most important aspect. When you meet with the governors and those of us that manage with this, that's the number one thing we all agree on. Flexibility is key.